for the New Jersey Learning Collaborative.
And I'm Jody Green. I'm the other co-director for the New Jersey Dual Learning Collaborative in the Southern region. And happy to be on the call. Happy to be on the call with Gabriel today.
Good morning, everybody. My name is Gabriel Ortiz Gallego. I am a navigator / application counselor for New Jersey Citizen Action Education Fund. I'll be giving a brief, going into detail about the presentation, who we are, what it is that we do, and I'm looking forward for you guys to learn something new. And if you guys have any questions, feel free to write them in chat, or if not, right after the presentation, I will be answering any and every question that I possibly can for you.
Thank you so much, everyone. So like Gabriel said, if you have any questions, please write them in the chat. Also, feel free to introduce yourself or your org that you're representing, where you're calling in from today, in the chat as well. Gabriel, if you're ready, the floor is yours.
All right, let me just get everything ready. Okay. Start this slideshow real soon. Okay. Great. Good morning, everybody, and welcome to today's webinar. Once again, thank you all for having me. In such short notice, I'm glad I could be covering for Laura, though. Part of what we do is we provide health services and, navigate a lot of people who don't know about what it is that they may qualify or are eligible for. That is part of today's program. We are now in the period of special enrollment, which is from February 1st up until October 31st. There will be some slides for you guys to see, and it'll go into a little bit more brief detail of what it is to come with the special enrollment. And we may proceed with the first slide. First and foremost, before beginning, just want to acknowledge that the work that provided the basis for the publication was supported by funding under a grant with the State of New Jersey Department of Banking and Insurance. The substance and findings of this work are dedicated to the public. The author and publisher are solely responsible for the accuracy of the statements and interpretations contained in this publication. Such interpretations do not necessarily reflect the views of the federal, state, or local government. So, who is New Jersey Citizen Action Education Fund? Well, we're a statewide grassroots organization that fights for economic and social justice. As you see right there, it gives you a list of what it is that NJCA does focus on. And one of those things is what I specialize in, which is the healthcare enrollment assistance. We also do tax preparation now that tax season is up and running. We do provide those services as well for people who are in need. We also provide assistance for financial coaching. A lot of people need help with financing and budgeting. We do have free services, and that's something that I would like to continuously emphasize, that people can take advantage of in these kind of services, as well as first-time home buyer counseling. And we also have the oil group that, we also give assistance to. All their information will be provided in a later slide, so you guys can always get that information as well. You can always visit us at our website at njcaef.org, and it'll give you a lot more brief detail and description of what it is that New Jersey Citizen Action Education Fund is. So going to what we were supposed to do, the Affordable Care Act, also known as ACA. What is ACA? A lot of people think that they know what it is that health coverage is, but they don't know the full details of it. So ACA, it covers people with pre-existing health conditions, things such as pregnancy, without having to charge more. So you won't have to spend more out of pocket on your end, and also provides free preventative care, gives young adults more coverage options, and lifetime and yearly dollar limits on coverage of essential health benefits, holds insurance companies accountable for rate increases. One thing that we did experience throughout this year so far, and it's affected a lot of families and individuals as well, has been with the increasing of these the plans, their plans and their rates. They've grown exponentially higher than they should, and it's an issue that we're still fighting, but we've come a long way, and a lot of people have ended up being satisfied with changing their coverage, if not finding something more affordable for them. It is illegal for insurance companies to cancel your health insurance just because you get sick. So never feel that if you lose your job or something, or if you can't work due to sickness, you lose your health coverage. That is not something that can be done on their end. It protects your choice of doctors. If you have a specific doctor that you'd like to go to, you are free at any point in time to stay with that doctor. All you would be advised to do is to make sure that whatever coverage that you decide to choose is the doctor of your choosing, your primary doctor in this case, would be, they would accept that coverage. And it protects you from employer retaliation. So what does that mean? In simple terms, let's say you get let's say your employer does offer you health coverage. However, that health coverage is a bit over your budget and it's something that you don't think that you can manage and take control of. The employer cannot force you to get that health plan. However, you would still have to be advised to seek a health plan that will still be affordable and can still be managed throughout the employer. Take charge of your health. To understand your healthcare, you need to answer these questions. So, why healthcare? Ask yourselves these questions. Why do I need health insurance? Or why is it important? Well, aside from the fact that you can be penalized in your taxes for not having health coverage, you also want to keep into consideration, okay, I'm a healthy person. Maybe I don't need to go to the doctors often. I haven't even gone to a doctor since last year, maybe 2 years ago. I'm a very healthy person. Well, kudos for you. I'm glad to hear that. And if you guys want to give me some advice on how to manage my health so I don't have to go to the doctors often, well, I would much appreciate that as well. But you also want to keep into consideration, maybe at this point in time, you're very healthy, you don't have anything going on, life is great, nothing goes wrong. However, life does happen, accidents do happen, and there are things that are out of our control that we cannot manage sometimes. And that's what makes health insurance very important. You may not need a doctor now. You may be looking throughout the rest of the year and saying, I'm not going to go to the doctors because I'm already a very healthy individual. However, sometimes it is good to expect the unexpected. And there may be a time where something may happen. And if you don't have that health coverage and you get really sick, or you suffer, God forbid, a bad injury, you won't have that coverage. So that's what makes that health insurance important. At least that, God forbid something bad happens to you, you have that, safe haven of knowing that you have the coverage to go through with your doctor and, get yourself fixed and cured. What do I need and want? What are my choices? So when you think of health benefits, you look at all the options that they have, and every health plan, depending on which one you get, some such as bronze, silver, platinum, gold, all of those plans offer different things. You may be someone who just wants the basic, just a checkup every year, maybe just to do an x-ray, just to get your vaccination shots or any other shots, and you just want the basic stuff. There's options for that. Or you're maybe somebody who has a family relative, or even yourself, who's going through a huge, moment in their life where they have a sickness that needs to be taken care of. Maybe cancer, or maybe something, that needs to be attended to very urgently and very repetitively on a yearly basis. That's when, you would have options such as silver, gold, platinum plans to look over those, and, you'll be able to see what it is that they have to offer you and what it is that you may need. And how much will it cost? How much can I afford? These are questions that you have to ask yourself, because more than anything, if anybody, including myself, I throw myself in there, if there's anything that we're very cautious of is how much we spend, how much we're willing to spend, and how much, we want to spend. So how much can I afford? Well, the good thing about us is that we have so many options for individuals who are seeking health coverage. Some people may not have the finance for it. Some people may not make as much as they should be, or they just don't have the room to get a health coverage. There are options where you may have to pay from 0 up to 50, up to 100. It all depends on, your circumstance and everything. So always look at your options. Even if you don't decide to go through with something, you can always review what options you have out there, because there are options where you don't have to pay anything, as well as there are options where you might have to pay something. It all depends on what it is that you're looking for. So always keep these things in mind before speaking with somebody like me, an assistant, a navigator that will be guiding you through the process of everything. So as mentioned before, why health insurance? Emergencies, it makes care affordable. Seeing the doctor for basic cares, if you do not have insurance, or if you're just going in point blank, can be from $900 or more just for a basic service. So having that benefit of, having the benefit of having that coverage does come a long way for a lot of people. But now, preventative services are covered by most health plans at no additional cost to you. So you're probably asking yourself, Gabriel, what is a preventative service? I'll tell you. Preventative services are yearly wellness visits. Those could be things such as blood, diabetes, cholesterol tests, cancer screenings. It also covers counseling. If you're somebody who's trying to quit smoking, you need dietary health plans. You want to get your life back in order. Drug abuse counseling, stuff like that. We also have things for mental health as well. You see right there, depression screenings. We do those preventative services are covered by these health coverages. Immunizations and pregnancy care as well is part of the deal. When you look at health insurance options, there are 2 different options, and I will go into a little bit of a brief description later on, but those 2 options are known as Get Covered New Jersey, which is the marketplace. That is where you're going to see a lot of people, are usually eligible for, depending on what they make on a financial basis yearly, and as well as New Jersey Family Care. Those are for people who may not be making as much or are retired. It may be for kids under 19 years old. And those are the kind of things that will qualify you for NJ Family Care. As you see right there in the center, special enrollment, this is the period that we are in right now, from February 1st up until October 31st. However, for open enrollment, although we are done with that for from last year, it will be coming back November 1st from up until January 31st of the next year. Open enrollment is a time where everybody and anybody is allowed to just apply. They'll be able to, just apply and see what options they have available. We were able to help a lot of families that were in need of, of coverage throughout the year this time around, and we expect it to be the same for this upcoming November. So as mentioned before, Get Covered New Jersey is the marketplace. It's a one-stop shop marketplace. You can receive financial subsidies to help pay the premium. So as mentioned, the government will help you with your finance with here. Depending on how much you make throughout the year, will determine how much you qualify for in financial subsidies. At no extra cost, by the way, to have an assister assist you. So if you ever come to me, if you call, if you set up an appointment with us, you do not have to worry about paying a fee. That is not included in what we do. However, if you do go through with a plan, depending on which plan you choose to have, you could be having to pay the premium for that. And what plans are offered? Well, you see right there in the bottom, Get Covered New Jersey works with 5 different plans. You have the Horizon Blue Cross Blue Shield, the WellCare, Oscar, AmeriHealth, and our newest addition, which is the CVS Health Aetna, which is actually becoming pretty popular and fan favorite for a lot of people. I've seen the benefits for it. It is really good depending on what it is that you're in need of. And as mentioned before, you don't just want to choose one because it's the best out there. You also want to see what options you have, and if any doctors, including your primary doctor, or if you don't have a doctor, any doctors that are nearby you accept these coverages. That is one thing that we do stress a lot for a lot of people. Do not just pick a plan because you want to, or because you've heard good things about it. Choose the plan because it's gonna best benefit you. Every plan is good in their own ways. However, always keep in mind, not every doctor accepts every plan. Now we can get to what it is that we are here for, the special enrollment. What is special enrollment? Well, certain life changes allow you to enroll in health insurance outside of the open enrollment period. So sometimes, like I mentioned before, life happens. We lose our jobs, or we lose a family member. We're probably moving from state to state. You probably had a newborn, or you adopted somebody, change in income, change in immigration status, or if you've recently gotten married or divorced. These are things that help you qualify for the special enrollment period. It is something that a lot of people take advantage of. And if, life happens and any of these scenarios were to happen to you, just know that you are not in a bad situation. You're not in a bad dilemma. You can always apply and get the health coverage that you need. As mentioned before, you are eligible if you're uninsured resident in New Jersey, uninsured dependent residing in New Jersey, a citizen or a non-citizen who is lawfully present. So if you know anybody who, as long as they're lawfully present and they've been in New Jersey residents for at least 5 years, that is the minimum requirement. They are eligible for the New Jersey Family Care. As mentioned before, what counts as a qualifying life event? This is what helps you qualify. So pregnancy, a loss of job, a change in income, immigration status or citizenship, death of a spouse, recently married or divorced, gave birth to a child or adopted a child, you just moved into New Jersey, or you are no longer eligible for NJ Family Care. These are things that help you be qualified for the special enrollment period. Some people do lose out in, their New Jersey Family Care due to whatever situations that prevent them from continuously being eligible. However, just because you lose your New Jersey Family Care plan does not mean that you are ineligible to apply for other plans. There are options out there, and this is part of that special enrollment period to give you that sense that you can still apply for health coverage, and you will find a coverage. However, when we look at qualifying life events, these are things that will not count. So voluntarily dropping a coverage. So if you're already in a coverage, but you just decide, I don't want this coverage anymore, I'm going to see what other options I have, that does not count. That would not count for you to be able to just apply for another one. You have to actually be terminated by, your health coverage to be eligible. Loss of job and originally not enrolled in employer's plan. So a lot of people do opt to not have their employer health coverage. They opt to seek elsewhere. That would not help you qualify. You would have to have lost your job as well as whatever benefits that were included within your employer's plan to be eligible. Newly eligible for financial help, but previously uninsured. So if you were already receiving, if you were not insured and you started receiving financial help, you started getting ways to make more money, whether it's you got a new job, a side job, or just receiving help through the government in terms of unemployment or anything else like that. you may or may not be eligible for applying for health insurance. Terminated from other coverage, from non-payment or fraud. You always want to make sure if you don't have the automatic payment already set up in your account, or if you're just lying on your application, those are things that may deem you ineligible for as a qualifying life event. Always be sure to be accurate with the information that you give, because this information does go out to the government. This information, they do go through the background checks, and they make sure that all the information is accurate. If it's not with fraud, it has to do with not making your payments on time. If you have any payments to make, some people don't have to pay anything, some people do. That may be the case for you. And divorce or death that does not result in loss of coverage. So sometimes we may lose a family member, sometimes we may divorce our spouse or ex-spouse in this case. If you were not a part of their plan to begin with, then you would not be, it would not qualify you as for a qualifying life event for the special enrollment period. Important information: 60 days from the major event. This does not include pregnancy or death, or 30 days from an income-based event. You have those days to enroll within that time period to enroll into a coverage before it is, not that it won't be accepted, but it will be a longer process for you, for sure. So when can I enroll? As mentioned before, special enrollment period is from now up until the 31st of October. So if you enroll anytime by the 28th of February, then your coverage would be effective March, the first day of March. Same thing with March. If you enroll within that time period before the 31st, your coverage would be effective April 1st. And then I guess you guys could see the trend going down. If you enroll between April, you'll have coverage by May, and so on and so forth. That's exactly how the coverage would be working for anybody. Same goes for open enrollment period. If you apply within November, you'll have coverage by December to January, and so on and so forth. Advanced premium tax credit. So what is an advanced premium tax credit? It's a tax credit that you can take advance to lower your monthly premium. As mentioned before, these are the financial subsidies that people can and should take advantage of whenever they are applying for health coverage. So what qualifies you for an advanced premium tax credit? First, make sure all the statements that you make, especially with your income, is accurate. However much you've made throughout the year, and whatever you plan to put on your taxes, make sure that those numbers are resembled when you're filling out the application as well for the marketplace. The amount of your premium tax credit depends on the estimated household income for 2022. So what does that mean? Well, or 2023 in this case as well. Household size does matter. You always want to make sure that you add all the individuals that live in your household, whether it's a spouse, it's a spouse or a kid or multiple kids or even other family members. If they all live in the same household and they all contribute in some way, shape, or form, or they're just dependents of yours, you always want to make sure to include them into your household size, because that will help the government estimate how much financial subsidies you may receive, and also advanced premium tax credit. So if you have a lower predicted income equals more owed money. A higher predicted income may receive a PTC back. You do not have to accept any of it. And PTC, by the way, is premium tax credit. You do not have to accept any or all of the advanced premium tax credit. And as mentioned right here in the bottom, be honest about receiving a premium tax credit to avoid penalties. Always be sure that when filing your taxes, that you know how much advanced premium tax credit you are receiving, and making sure that you implement that into your taxes. And remember to report income and household changes to avoid a penalty. That may be a change of job, That may be you're making a lot more than you expected for this year, or you may have taken a drastic downfall in your income. Always be sure to report that as soon as you possibly can to avoid getting penalized for it. Now, New Jersey Family Care. Well, it's New Jersey's Medicaid program, free or low cost insurance for these individuals. As mentioned before, for children who are under the ages of 19, they are eligible for the CHIP program, as well as adults from 19 to the age of 64 or disabled people as well. And it is something that you can apply for all year long. You do not have to wait at any point in time. So eligibility for that would be based off of if you're a resident here in New Jersey. It wouldn't be New Jersey Family Care if you weren't a resident in New Jersey. I've had believe me, I've been caught by surprise when somebody tells me they are not a resident in New Jersey, they live in PA or New York, and they ask if they are eligible for the program. This is just New Jersey citizens and residents. U.S. citizenship, or if you are lawfully present, must have immigration status for 5 years or more. And also, it depends on your household income and size. And if you ever want more information, you can always actually contact New Jersey Family Care at 800-701-0710, and they'll be able to assist you with any questions or doubts that you may have. Medicaid rules have changed. This is something that's fairly new, and beginning April 1st, it will come into effect. New Jersey Family Care will resume eligibility redeterminations. The processes can take or will take 12 months. It will be completed by next year by May 31st, approximately. Special populations will target with care, aged, blind, or disabled. If you have moved, you can always call the number right there at New Jersey Citizen Action to update your address and contact information. That's where you guys would contact us. And if you already have an account and you need something to be adjusted, whether it's the income or if you've moved, in this case, you can always contact us and we'll help you adjust all your information to avoid you getting penalized. And make sure New Jersey Family Care can reach you. Respond to mail from New Jersey Family Care and or Medicaid. Look for and respond to mail from the state of New Jersey or your local county board of social services. If New Jersey Family Care requests information, respond as soon as possible to avoid a gap in your New Jersey Family Care coverage. This is just a brief timeline of the changes that have been made so far and what is expected to be made throughout the year. As you can see right here, outreach began. Eligibility reviews resume starting in April, as mentioned in the previous slide. These are things that you want to take advantage of and that you should be socially aware of, because these rules will be coming into effect, and it can or will affect maybe not you, but somebody that you know or loved ones or other friends and relatives. I'll just stay here for a bit just so you guys can see. Luckily, this is being recorded, so we have the bright side of you guys can always look back at this and you can get this information out. And eligibility unwinding special populations. Details of renewing eligibility will be different for different categories of New Jersey Family Care members. Some eligibility groups may require additional or different documentation. So you may have provided the documentation such as proof of income, proof of citizenship. Sometimes they are going to still send you letters, or they are still going to be on top of you saying, listen, we need more documentation from you. And it does get annoying and it can be tedious. However, it is very important that you provide all the documentation that is necessary so that you can continue on with your coverage. DMHS will work with the community and state partners to provide targeted outreach and inform to specific eligibility groups, including the aged, blind, and disabled members. All members should make sure Medicaid has your correct mailing address by calling that number down below. So if you've already provided accurate mailing address, then you shouldn't have to worry too much about this. However, if you have changed an address and you haven't updated it, or you have updated it, but you haven't been receiving mail, you want to always double check and make sure that, you know, all your information is correct so that you're receiving everything that you need and that you are not putting yourself into any sticky situations. And always respond promptly to all mail from New Jersey Family Care. There's going to be some mail where you don't have to respond. There's going to be a vast amount of mail that you may receive that may just tell you, listen, we need a response, we need documentation, as mentioned before, or we just need you to update some information. And now the Cover All Kids program, our newest program that began in the beginning of this year, actually. It is for children under the years of 19, regardless of immigration status. So if it's for both documented and undocumented kids. These are just prime examples of what it is that helps them be eligible and qualify. Incomes up to 355% of the federal poverty level. So an example would be $8,210 per month for a family of 4. That's when you wouldn't be eligible. No waiting periods, no premiums, does not count against public charge. And as you can see down there, this is something that a lot of kids have been taking advantage of. We've had both the honor and the privilege to help a lot of families who don't have that citizenship, who are not undocumented in this in New Jersey, who have came to us, done the applications, and we've seen an increase in all these kids receiving, you know, the benefits that not only they apply for, but they are deserving of. Every kid should be covered. Every kid does have the right to, you know, be able to go for a doctor's visit, exams, tests, x-rays, receive the prescriptions, dental services, as mentioned before, preventative screenings. All of these kids now have that saving grace of knowing that they can apply for this application. And more often than not, I won't say 100% of the time, because there could be some delays or there could be some things that prevent it. However, a good 95 to 99% of the time, every kid will be covered through this program. And it is something that is both a blessing and we're all grateful for that can be used. So if you know somebody who has a kid who's undocumented, feel free to send them over to us. We'll be happy, more than happy to do the application for them, knowing that they will have that saving grace of coverage. And that is where it goes to us. So you're probably asking, who's this guy speaking right now? Why is he speaking? What does he do? Well, I'm a certified application assister. So we're properly trained individuals, and both not only trained, but certified. And we give unbiased assistance. We help every and any person that comes to us. And if we don't help out with the application, maybe you just need a little bit more information. We counsel you and we make sure that you understand what it is that you are getting yourself into. We assist in the navigating through the Get Covered marketplace, as well as New Jersey Family Care. And once again, I will specify, we are a free service. So you can come to us and not have to worry about giving any money to us. We don't accept anything like that. It is a free service that we give to you and anyone else who is in need. And we do both English and Spanish. We have a handful of assisters who are willing to help you and set up appointments for you at any point in time throughout the year. And if you only speak English, great. If you only speak Spanish, great. So after enrolling, let's say you've already filled out the application and you've already received your card. You got to find a doctor. Make sure that the doctor that you have either accepts it, or make sure you find a doctor that is located to you nearby that you want to go to make sure that they accept that insurance. It is recommended that you call your insurance company to see what options that there are available. However, you can always check on the website. If not, you can Google it yourself. Let's use WellCare as an example. You can go on Google and you can just type doctor's offices that accept WellCare near me. And if you have the location already set up on your laptop or PC or even your phone, then it will give you all the options of doctors that accept that WellCare. And if you already have a primary doctor and you're looking for a different coverage, and you're going from, let's say, Horizon to Oscar, verify with your primary doctor that you are switching to Oscar, and you just want to verify if they still would accept that coverage. Sometimes your doctors may say yes, sometimes your doctors may say no. It all varies depending on them. And consider using providers in network versus out of network. So in network, I believe that's a bit self-explanatory. It's within the New Jersey parameters, and out of network is anything outside. There are options for both, but not every plan that you look up will have both those options. And remember, before, during, and after, to report your qualifying life events on time. Be honest when reporting your yearly income, and maintain your health and obtain health insurance. Those are key things that if there's anything that you should take away from this presentation, these are the things that I would 100% just recommend that you guys keep into consideration. It's things that will help you. It's things that will benefit you in your lifetime. And we're reaching towards the very end right now, but we did have a location in Elizabeth. However, we'll be moving our location into Newark now. So if you ever want to do an in-person appointment, we do both remote and in-person. Some people prefer the in-person, and if that's the case with you, or somebody you know prefers doing it in person, we are located in Newark, New Jersey, in 165 Halsey Street. My name is Gabriel Ortiz Gallego, as mentioned before. My phone number is not the first one, that is the office number, but you can always jot that down. My work cell, if you want to speak to me personally, you can always contact me at 908-808-1007, or you can always call the toll-free number of the New Jersey Citizen Action, and get your information from there. I have also provided 2 emails, the Get Covered at njcitizenaction.org. That one will just open a wide variety for anybody that works within the ACA grounds to be able to view, and you'll be able to speak to anybody there. However, if you'd personally like to speak to me, all you'd have to do is write down my name, Gabriel, at njcitizenaction.org, and I'll be able to help assist you in any way that I possibly can. And if you want any information on the other services that we provide, as I mentioned before, we also do financial coaching. We also do tax preparation, and the oil group as well. There's the information that we have here on board for you. Feel free to reach out. All our services are free, and that is something that I cannot stress enough. These are things that people should take advantage of, and as mentioned before, we are helping our community, especially here in New Jersey, all individuals get the help that they both need and deserve. Now, that is the end of my presentation. However, if there's any questions within the chat, or if somebody wants to, go off the mute and ask me the questions personally, I will freely be able to answer any questions that you may have. I'll actually look over the chat now to see if there's any questions.
Thank you so much, Gabriel. I did see some questions pop in earlier in the chat. One of which was from Anai Hernandez. I hope I'm saying your name right. How about children/adults who have DACA? Can they apply for health insurance?
They can apply. It is always recommended that they do apply. You never know. I feel that's something that, a lot of people don't I guess the fear is always, something to be implemented, and with every amount of reasoning. For children, for sure. Like I said, that's the part of the Cover All Kids program. Every and any children is eligible to apply. And for adults, it could be a little bit more complicated. However, while going through the process of the application, as long as they've been a resident in New Jersey, as long as they've had that status for at least 5 years, as well as been a resident for 5 years, they are still eligible to apply.
Thank you. The next question I have from Leslie Ezra asks, can you clarify what qualifies as lawfully present? Leslie, if you would mind, can you come off mute and then expand on your question a bit?
Yeah, no, absolutely. Thank you so much. So yes, so just to clarify what that means. So does it mean that they've been they are a legal resident, or that
Basically,
they've just
yeah.
residing?
A legal resident, the only thing that I would say is ITIN numbers do not count. But if they have a passport, if they have a visa, if they have a green card, permanent residency, or a social is something that is definitely heavily asked. As long as they have a social, they are considered lawfully present.
Okay.
ITIN numbers do not count though. We've had a lot of people come up with that, and that those do not count. I think we're in the midst of fighting for that, but because those are people who are paying taxes, but there's no solution to that yet.
Okay, and then for the kids, so the kids younger than 19 years old, they do not. So what do they need? So they don't need to have a legal or lawful status, but what kind of documentation is needed to apply?
Documentation would be okay. So let's say they only have a social. When filling out the applications, they'll have to provide basically the documentation of your social. Lawfully present, whatever kind of documentation that you have. So let's say when you're filling out the application, you don't have that I'm forgetting the word. You're not a citizen, you're a naturalized citizen, or you have a green card. More often than not, they're going to ask you to provide the documentation, the proof of that. Can you just elaborate a little bit more on your question?
Oh yeah, because I think all kids covered or something like that was
Cover all kids.
Yeah, so
Yeah.
cover all kids. So that, I believe you said that kids do not have to be
They
documented.
No, they don't.
So what kind of I guess information parents need to have to be able to apply? Because you did mention Social Security, but I'm not sure if they are able to get a Social Security.
So no, so
not.
in those cases, when you're filling out the application, those parents would probably just have to say they don't have a social. If they've applied for one, there's going to be a question that asks you, I've applied, but I have not received a social, or maybe I'm not eligible for a Social Security card yet. That's perfectly fine. The point of the program, in that case, let's say the parent as well is trying to apply, that could delay the process. If not, that could just deny. I mean, the parent is 100% going to be denied, but if you're filling out the application for the kid, because the parents are part of the household for the most part, you would have to include the parents' names, who they live with, and if they are dependents, if the kid is claimed as a dependent, then you always have to make sure to add, that parent. If the parent isn't applying, then, just saying that they don't have a social or anything does not matter. However, there has to be proof of income. The parent has to be making something. We've had some situations where it's just a mother and their child, but the mother does not work. New Jersey Family Care will look at that and they'll say, that's weird. If the mother has no income and the child doesn't have any income either, how are they sustaining themselves? Those are the kind of things that, New Jersey Family Care does question. Even if you're getting like some kind of a cash flow going, or you're getting help from a family member or something, you want to make sure that you are adding proof, some small proof of income, even if it's not going in your taxes. That is something that is definitely stressed out a lot. Make sure that when filling out the question of income, if you're not working or you lost your job or you just don't have any money coming in, if you're living with a family member or if you're living with somebody who does have, who's giving you a financial help, include that into your statement, your application statement.
One last question, if you don't mind, since you're
Yes.
answering my question. Would you mind just expanding or elaborating on what are the mental health services that qualified for both adults and especially for children?
Yeah. So I actually got off the phone with a client earlier, expressing how their child has some traumatic experience right now, feelings of abandonment, anxiety, stuff like that. Those things are covered. Depression is also something that is covered as well. Preventative care in general just goes towards any mental health aspects of that can be counseled.
So I'm sorry, I guess to clarify, so what you're saying, when you say those things are covered, are you referring to ongoing therapy sessions are covered or only like screening, mental health screening?
That would vary within where you would go for coverage, because as mentioned before, you can apply and you can receive the help of the preventative care services. That doesn't mean that every single doctor or person that you go to will take it. Some people just do the preliminary, the screenings, and that's it. Some doctors will go the distance and provide you the free the full service. That's something that you always want to verify. You can't just point blank say, okay, I have preventative services now. I'm going to go to any doctor and they have to attend me. It could be the case, but you better play it safe than sorry.
Thank you.
Mm-hmm. Any other questions?
Thank you so much for that. There was another question regarding the content that was in your slide deck. I know that we'll be able to access it, but if a person wanted to, let's say, distribute it amongst their general community, where would they be able to go? Like, is there a site that they can go and print these and share them?
Yeah. So in terms of just general questions, or general answers, or what is it that they want? Because they can there's many ways to do it. You can contact me, as you see right there, through or get into contact with somebody through Get Covered New Jersey. I'll go to the slide all the way. It was in the beginning. You can always get more information as well through the New Jersey NJDLC.org, as well as the Get Covered New Jersey site. I'll actually type those down in the chat as well to make everybody's lives easier.
Thank you so much. Does anyone have any other questions for Gabriel?
I saw there was another question from Rosita. Rosita says she has a family that are all documented. They applied for New Jersey Family Care, but it's taken a while to get a response. Do you also help families find out what may be going on with their application?
So that varies depending on how long ago you applied. There are still families who, depending on what they qualify for, of course, it will take time. So with New Jersey Family Care specifically, it could take anywhere from 2 weeks to 45 days. It's not fun, but people have to understand there's a lot of applications that go through, and especially now with the Cover All Kids program, where a lot of parents are taking advantage of it, the process can be delayed. However, what I've seen with the Cover All Kids specifically is I've had family members that have received a response within 2 weeks, and great. That's like the minimum amount of time that it takes. And I've seen families have to wait just over a month. It's something that we don't have control over. However, what we always recommend, if it's been over 2 to 3 weeks, 3 weeks is our point. If it's been 3 weeks and you have not received a single response, and that could be through phone call, it could be even a text message or a mail or email, then you can always contact us. We'll call New Jersey Family Care together. And, you know, they'll probably just ask for small information, whether it's social. If you don't have a social, then you'll just say, you'll provide your date of birth and your name, and they'll track down your name through there. And then, you know, we'll just find out any updates to your application process. Like I said, it could be delayed a little bit. It could be that they, to be frank with all you, it could just be that they sent something through mail and you never received it. So, you know, they probably did, they probably didn't. It just didn't get into your hands. More often than not, though, if the first time that you receive something from New Jersey Family Care, it may be just for proof of documentation, more often than not. That's how it usually starts. And then once they get that information, whether it's faxed or you mail it to them, you should get a response back within the next week or two from them. But if you do need help getting that information, then by all means, I advise you guys to contact us and we'll help you through that process. Because also I've called New Jersey Family Care many times, and going through the whole operator process is very annoying sometimes. Any other questions?
Yeah, would you be able to share your slides with us so that we can share it out to the participants today?
Share my slide. Wouldn't be able to share it specifically just because of our protocol.
Okay.
Is there like something specific that you wanted to see?
I
'Cause I
think
can send you
everyone kind of
information on
just
that.
wants to have all this information so that they can share it out as they need to with their families.
We have flyers.
Right.
I can always email you the flyers that we have, and
Okay.
that's just a pretty brief and detailed information that we have that will give you all the information, contact information, and as well as what makes you eligible for whatever it is that you're looking for.
Okay, so if you
Oh.
do that, if you do that and share that with us, we'll make sure that we share that out with the participants so that
Of
they.
course,
And they have
just
your contact information.
of course, after this meeting, I'll be sure to email all of you together, and I'll provide not only will I provide the flyers, but I'll go into a brief little description of what it is that what services we offer.
And Gabriel, thank you so much. I will definitely be following up and know if you guys are also able to go into the schools to do kind of presentations. I'm from Christina Sykes Academy, and we serve families from the Mercer County area. So I'm interested in bringing all that information to us. So thank you so much, everyone.
Of course, I'm glad to help. That's part of what we do. Just a little bit about myself. Just this is something that I am very passionate about. Helping the community is something that I've always strived for. Me being a superhero fanatic, Marvel, DC, this is my way of just saying I feel like a superhero in this case. And, you know, being able to help people within the New Jersey community is something that, you know, I strive to do. And hopefully I was able to show that within the passion of the presentation, and as well as the information that was given to you. But, you know, I'll provide the information to you guys very soon. And I really do hope that this was an informative and helpful presentation for all of you.
And Lacey, did I say your name? Lacey? Hi, Lacey. I dropped my email and Ria's email. She is also on this call. If you would be interested in having something like this for your families, we can also set that up, a presentation just to, you know, for whatever group that you think this would benefit. So just reach out to us and we can try to set that up for you.
Wonderful. Thank you so much. Where's your email in the chat?
I'll put it again. Yep.
Okay, thank you.
As well as if you know any family members or even or other organizations that you feel that will benefit from this kind of you know, presentation. We do different ones as well. You know, open enrollment is done, so we wouldn't be focusing too much on that. We have the special enrollment. We're on the verge of creating just one specifically for Cover All Kids. We also have one for avoiding healthcare scams, because we know that is an ongoing issue right now. people get a lot of emails, people get a lot of things in the mails, and they think it's a legit healthcare mail. And well, you know, we help educate people on what counts as what is a healthcare scam and what isn't a healthcare scam. And that is something that we've also been fighting for as well, because we do get calls, and then when we explain our services to them, they're like, this is a scam. So, you know, we are still in the process of educating people. We do provide different kinds of services, as mentioned before. This outside of the health coverage aspect, we have financial coaching, the oil group, and the tax preparations. So those are things that, you know, people can take advantage of and that we have to offer within New Jersey Citizen Action.
So if there are no more questions, I would just like to thank Gabriel once again for showing up here for us and giving us a very informative presentation. Once again, if you guys need any additional information, you can contact Danica. She just dropped her email in the chat, or you can go to their site, njcaef.org, which is also in the chat. Thank you all for joining us, and enjoy the rest of your afternoon.
It's nice meeting everybody. Bye-bye.
Bye-bye. Thank you. Great job.